Herpes, or herpes simplex, is a viral infection that causes sores that most often appear on the face or in the genital area. There are two specific types of herpes infection. Infection with herpes simplex virus 1, HSV1, is usually associated with cold sores of the lips, mouth, and face. These sores appear as fever blisters and eventually crust over into scabs. Infection is usually acquired in childhood and is transmitted by saliva. Infection with herpes simplex virus 2, HSV2, also called genital herpes, is a sexually transmitted disease. It manifests as sores appearing on the penis, scrotum, labia, vagina, upper thigh, buttocks, or around the anus. Symptoms of both types of herpes can range from mild to severe. In fact, some people have symptoms so mild they may not realize they have herpes. Although a person with herpes may not always experience outward symptoms of the virus remains present in the body. The virus can be reactivated by stress or illness and can be spread through skin-to-skin contact. Transmission is possible even when no lesions are present. Herpes can be transmitted to infants during delivery if the baby comes into direct contact with the virus. There is no cure for herpes. However, medications may help reduce herpes outbreaks.
Nobody's gonna speak up. I'm the one who's gonna have to say it. All right. Genital warts!
Escherichia coli, also known as E. coli, is a bacterium commonly found in the gut. Several types of E. coli exist as part of the normal flora of the human gut and have several beneficial functions. Most types of E. coli pose no harm, except for serotype O157H7. This can cause food poisoning in humans and can become life-threatening. A healthy adult will normally make a full recovery from E. coli O157H7 within 5 to 7 days. However, young children, elderly adults and patients with weak immune systems can develop a potentially fatal type of kidney failure called hemolytic uremic syndrome. Symptoms of E. coli depend on the site of infection and which type of E. coli is causing the infection. Classic symptoms include severe abdominal pain, vomiting, and diarrhea that may be bloodier. Symptoms usually become apparent between 1 and 7 days, typically between days 3 and 4, and can last up to 7 days if there are no complications. A large number of infected people have no obvious symptoms, however, they can unwittingly spread the infection to others. The specific treatment will depend on the type of infection. There are no current treatments that can cure E. coli 0157H7. It just has to run its course. Cystitis infections usually go away by themselves after a few days. Sometimes a short course of antibiotics may be prescribed. Most doctors advise patients to drink plenty of water to avoid dehydration and get lots of rest. A sample of faeces should be sent off to confirm that it is an E. coli infection. Any contacts should be screened and the patient should be off work or school until the infection has cleared. How do you prevent E. coli? To help prevent the risks of E. coli outbreaks, keep good hand hygiene, particularly after using the toilet and before preparing food. Wash fruit and vegetables, particularly green leafy ones, to remove excess dirt, reducing bacteria. Cook meat well, especially ground meat.